My name is Gloria Nunn. This presentation covers an overview of diabetes and a treatment plan to prevent complications. The objectives of this presentation are: prevent an overview of diabetes, explain the pathophysiology of diabetes, list 4 diagnostic tests that is frequently used to diagnose and screen for diabetes, identify implications of diabetes on the body, discuss the non-modifiable and modifiable risk factors of the disease, discuss the 3 levels of intervention: primary, secondary, and tertiary, discuss the treatment plan to minimize or prevent diabetes, discuss new technology impacting diabetes, and display the concept map. About diabetes. Diabetes is increasingly growing in the United States and bridging across many cultures and age groups. In the United States alone, it affects 8.3% of the population. Even in my family, diabetes is present. The prevalence of diabetes in India, China, also continues to be explosive. There are many factors involved in this massive growth, to include lifestyle changes, sedentary lifestyle, and diet. The implication of diabetes often is related to vascular disorders. Diabetes impact the body of the young and old in various ways, to include the heart, kidney, eyes, and nerves. Pathophysiology of diabetes. Diabetes occur when the mechanism of insulin production is delayed. Delivery fails. Insulin, a protein hormone, is produced when the glucose level influences the B cells of the islets of Langerhans, which in turn produce insulin that is deposited in the intracellular space. It is then passed to the bloodstream and into the circulatory system. Depending on the defect in the mechanism of insulin production or action, an individual may be diagnosed with type 1 or type 2 diabetes. Diagnostic tests. According to the National Guideline Clearinghouse, there are primary tests that can be used to diagnose diabetes. These tests can be used in screening and management of the disease. The tests include hemoglobin A1C, oral glucose tolerance test, and fasting blood glucose. Random blood sugars are taken to monitor and maintain blood glucose in most cases. The hemoglobin A1C provides the average blood glucose accumulated over several weeks, which gives an indication of long-term glucose control. Blood lipids and urine testing can also be used to look for signs of complications in the diabetic. Implications of diabetes. There are many implications of diabetes, such as cardiovascular disease, kidney disease, blindness, nerve damage, and peripheral vascular disease. Diabetes has a major impact on the cardiovascular system. Myocardial infarctions occur in 14 out of 1,000 of the non-Hispanic whites, 9 out of 1,000 in blacks, Hispanics, and Asians. Effective control of blood pressure and lipids in patients with diabetes has shown a reduction in the incidence of cardiovascular abnormalities and improved survival rates. Better glucose control reduces vascular disease such as diabetes retinopathy, kidney injury, and neuropathy. Blood thickness can lead to microcirculation and negative effects of the eyes, the kidneys, and the heart. What are some of the non-modifiable risk factors of diabetes? Those things that we have no control of. The non-modifiable risk factors such as age, ethnicity, and family history is out of our control, but makes us aware of the probability. People who have diabetes are living longer due to the advances in treatment for the disease and its associated complication. Longevity would be a part of the cause to further increase in the rate of the illness associated with diabetes, mainly Asian individuals and minority groups. By 2050 in the United States, it is projected the number of individuals identified to have diabetes will grow to 48.3 million. Research Results provide proof that changes in lifestyle related to diet and exercise may delay or prevent diabetes in individuals at high risk. People with a family history of diabetes have a higher risk of getting the disease, according to the American Diabetes Association. Modifiable risks that we can do something about. A major threat to our overall health is obesity. However, losing weight for many Americans through dieting is a struggle. The act of changing eating habits and increasing physical activity can pose challenges. It does for me. Even the smallest weight loss has a positive influence on health and well being, as well as improving the quality of life and living a longer life. Losing weight also has a beneficial impact on cholesterol and blood pressure. Lifestyle modifications that can improve health by reducing calorie intake and increasing physical activity should be practiced. An uncontrolled blood sugar will result in many risk factors of diabetics in the long run. It has shown that tight glycemic control will reduce the incidence of cardiovascular disease and decrease death. There is a greater risk for developing neuropathy, retinopathy, kidney disease, and with uncontrolled blood sugars. So, what is the plan? The diabetic treatment plan. The treatment plan for diabetes focuses on reducing the incidence of complications, which are many. Diabetes is a complex disease that impacts many systems in the body. Many of the problems caused by diabetes are damage to the retina, renal injury, reduced blood flow, heart attacks, decreased ability to heal, and an increased potential of infection. Diagnostic tests. According to the National Guideline Clearinghouse, there are primary tests that can be used to diagnose diabetes. These tests can be used in screening and management of the disease. The tests include hemoglobin A1C, oral glucose tolerance test, and fasting blood glucose. Random blood sugars are taken to monitor and maintain blood glucose in most cases. The hemoglobin A1C provides. So, what are some of the interventions? There are 3 levels of intervention that can be used to prevent or maintain good health. Primary interventions are the first act against developing diabetes. Education helps people with diabetes manage their disease through knowledge. The focus of education is on eating the right foods, exercise, medication management, and more. The focus is on self-behavior. The focus is on self-care behavior as well that are important to fully enjoying life. Therapeutic lifestyle management must be discussed with all patients with diabetes and pre-diabetics at the time of diagnosis and throughout their lifetime. Physical activity is vital to the prevention of type 2 diabetes. Even through exercise can reduce or prevent diabetes. 50% of Americans do not get 30 minutes of physical activity needed per day. The act of changing eating habits and increasing physical activity can pose challenges. Even the smallest weight loss, however, has a positive influence on health and well-being as well as improving the quality of life and longevity. Losing weight also has a beneficial impact on cholesterol and blood pressure. Lifestyle modifications that can improve health by reducing calorie intake and improving physical activity as well as screening is recommended. Secondary interventions involve maintaining an illness or limiting long-term disease. The goal is to detect pathological changes in the attempt to control the disease progression. Screening is important to early diagnosis and treatment. Individuals with diabetes should get routine blood sugars monitoring, proper diet, exercise, and regular exams. Tertiary interventions. The goal of the tertiary intervention is to manage the disease in order to minimize complications. Diabetics or diabetes can have a great impact on one's functional abilities, lifespan, and quality of life, as mentioned previously. It is important that the right resources, such as rehab services, diabetic education, and blood monitoring and support groups, are easily available. So, some of the new technology out there, what is going on with diabetes in the techno field? New technology is being developed to assist in the maintenance of diabetes on a regular basis. Apps can be used on phones, tablets, computers that track meals, glucose, and even send reports to doctors. Smart pumps that give insulin as the body needs it. Continuous glucose monitors that can take blood sugars in minutes. Texts, calls, or even emails that remind a person to take their medication is on the rise. So, looking at the concept map, diabetes mellitus. Two types: type 1 of diabetes, which is caused by the insulin deficiency and primarily in young, and type 2, that's caused by the resistance, usually and occurs in older adults. Some genetic and environmental factors also play a part. There are non-modifiable factors of age, family, ethnicity, and modifiable factors of obesity, blood sugar, and diet. Implications of diabetes: cardiovascular disease, renal injury, eye problem, nerve damage, PVD. Treatment interventions include education, diet, screening, exercise, follow-up, rehab, and diagnostic tests that can be used: fasting blood sugars, hemoglobin A1Cs, glucose tolerance, random blood sugars, and urine. This ends my presentation on diabetes and the treatment plan. Thank you for being a part of this presentation, and I hope you learned from it. Thank you.